from next part. So starting from here now you have studied the glenoid fossa or glenoid cavity. What is going to attach over here? So the next long tubular bone, it is called what? Yes. So you can see over here it will be having one upper extremity again and lower extremity, and the upper part is going to be head. So this head will be attaching towards where? The glenoid fossa or glenoid cavity. Just below the head there will be a small line running over here. We call it what? This is anatomical neck. Understood? So we have two necks over here. We call it anatomical neck. It just run, yes, below, yes, after. So you can see, I will tell you about the twist, what happens below. So this is head just below, and lateral to the head will be anatomic neck. After that you can find what? Two tubercles. So it is tuberculum major, which is lateral side, or major, and you can see what? Tuberculum minor, which is what? Medial, and which is below. Yes? So if you remember about femur, we have trochanterus. Here it is something similar. Yes? And from here, from major tubercle develops what? One line will be developing over here. Yes? So this line is called crista tuberculi major. So it is called what? Major tubercular crista. So it will be originating over here and it will be coming anteriorly this way. Understood? And if you see here, there will be another one, we call it crista, which is coming from, yes, it is minor tubercular crista. So this will be forming, you can call either it is crista once it is thick, or it will be forming either in some book they write it as lips. Yes, this is what? Major tubercular lip, and this is minor tubercular lip. In between you will be getting a sulcus, we call it intertubercular sulcus, through which what will be attached over here, which will be going and attached up. Yes, long head of biceps, and this tendon will be attached over here to go up, and it will be attaching where? In the supraglenoid tubercle. Clear? Now you can see over here, once it is coming, both of them are coming in the anterior surface, you will be finding what? So it is not very anterior, so you can call it anterior or lateral surface. You will be finding a very prominent tuberosity, we call what? Deltoid tuberosity. So deltoid muscle originates from three parts. This is clavicular, from acromial, from spinous part, and it will converge together and it will come and attach where? At deltoid tuberosity. Understood? So as we have seen earlier, yes, like femur, here also there will be what? Three margins, yes, and three surfaces. It is not that very important, but they will be also having what? Similar, this is called shaft, yes, shaft, or we call it body, and here also you will be having, as compared to our, yes, femur, here will be like three lines and three surfaces. Clear? Yes? You can see from other side, yes? So you can see from posterior side, and I will explain you only one thing, like I just have to tell about this sulcus for radial nerve after explaining next part. Yes? As I already told you, yes, we will be having three borders and three surfaces will be there. Yes? One, this lateral border which comes below, and medial border which will be coming over here. Yes, it will become little prominent before it is attaching toward what? Epicondyle. Similar to a femur, if you will see the lower border, then I will explain this. Femur, yes, we have two condyles and two epicondyles, because they are long tubular bone. If you come to the border lower, yes, we will be having, instead of condyles over here, we will be having two structures, because there they were condyles and articular surfaces. Here, because radial head and olecranon fossa, yes, it will be little different, like the structure will be little different from our tibia and fibula. So the structure of condyle is modified over here. So instead of condyle over here, you will be having on the lateral side, it will be, we call it capitulum of humor. And there will be a gap, or there is a sulcus over here. After that you will get a structure, we call it trochlea of humor. Yes? Trochlea of humor. So in this, what will come and attach? The head of radius will be having an excavation. It will be attaching over here. Yeah? And here what is there? Trochlea is there, and trochlear fossa will be there. And ulna, it will come and attach over here. Understood? So you can see over here we have above this is called trochlea. We will be having a small fossa, we call it what? Coronoid fossa. Understood? So if you see anterior part of ulna, there is a process called coronoid process. So once it is this coming this way, once you are flexing, and this coronoid process will come and attach over here. So it is giving quite what good configuration for our what movement, flexion and extension. Yes. So because it is coming and attached properly over here, at this level you cannot move it laterally because they are fixed properly. Yes. So if you take this, what joint we call it, cubital joint, yes, or humeral ulnar joint, it gives what? It will give flexion and extension. You cannot move it this way. But it is not moving here, it is moving here. You cannot move. Why? They are fixed over here. Above this again similar to this for the movement, yes, once you are flexing, the part or remaining part of head of radius will come and attach. Where it is fossa radius. Clear? Yes? Above this, so this is considered to be like condyles in our femur. So lateral to this you will be finding what this is, what? Lateral epicondyle, and this is called what? Medial epicondyle. Understood? Lateral epicondyle and medial epicondyle. You can see over here, similar to our femur, yes, there will be what? There is margo or lateral margin and there will be medial margin. Once it is coming below towards the epicondyle, they become quite thicker. At the lower border, we call it what? Crista supracondylaris. Lateralis or lateral supracondylar crista. It is a continuation of what? Lateral margin. Understood? Once it is coming from medial margin, this will become little thick. We call it what? Medial supracondylar margin. Yes? You can see below this you will be finding there is a process, we call it a supracondylar process. And below this we will be finding what you can see over here. Yes, epicondyle. Yes, crista is coming. Here you can find a small process anteriorly. Yes, we call it what? Supracondylar process, and you can come behind. So it is from posterior side. This is what you are having epicondyle. Anteriorly you will be having what process is supracondylaris. Behind you will be having a small sulcus where our ulnar nerve will come quite superficially over here. If you do over here, you get current. Yes? You can get current. Sometimes you bang it like this and you get a current over here. You understood? Because ulnar nerve is lodged over here, it is quite superficial. You can touch here. This can be touched. This is what, here if you put your hand, this will be what? Medial epicondyle, and this is lateral epicondyle. And here, behind this, you get this sulcus where ulnar nerve, it is covered by, again, fascia, you will get ulnar sulcus. Here ulnar nerve is superficial. And it is easy to damage ulnar nerve, it is because it is superficial. And once you press it, yes, one will give a bang over here, you might get current. Why it is coming superficial? Clear? Okay, posterior. So this trochlea is continuing like this. If you remember the lower structure of femur, it is similar. Yes? And once it is coming over here, it is continuing till over here. And above this we will get what? There is a fossa for olecranon, or we call it olecranon fossa, and you will be having in ulna what? Olecranon process. So once you extend, it will limit the extension by coming and fixing into this fossa. Understood? Yes, triceps will be attached. And what extension? Triceps is doing. And after this you cannot do extension. Why? Now this olecranon came and it came inside the fossa. How it will move after this? It cannot move. Clear? Yes? So this is the lower border. Once you come in the middle part, yes, middle part posteriorly, there will be a canal which will be running. Actually, we cannot see this canal right now because this canal is formed by muscles posteriorly. Anteriorly, it is formed by posterior part of humerus. So here you can find sulcus for radial nerve. So we call this canal runs from like this, lateral to what? This way. So we call it, sometimes we call it spiral canal. So anterior part is formed by what? Sulcus for nervus radius. So we call it in Latin sulcus nervi radialis. It comes, yes, from lateral side and medially. Posterior side it will be covered by triceps muscle. So after closing by triceps muscle, this will form what canal? Canal for radial nerve, or we call it spiral canal. Yes? Spiral canal. So here it will be closed. Now you don't have muscles, so here you will be having an indentation for this radial nerve. This is called sulcus for radial nerve. So for example, if there is a fracture of humerus at this level, you can damage what? radial nerve which comes over here. Understood? If you fraction over here. Of course, behind what is there? Radial nerve, you can damage it. And below this level, or you can just see below the level of this minor tuberculum, you can see another one neck. So this part is called surgical neck. So this is the most common place where there will be fracture of humerus. So anatomical neck, next, if you see it is just below and lateral to the head of humerus. It is not the main place where you will be getting fracture. But if you see this place, it's quite, yes, it is quite thin. And if you see the angle. And if you remember about femur, I told about angle. What do you call the angle? Collo-diaphyseal angle. Yes? Collo-diaphyseal angle. You remember how it will be? Yes? So if it is less than 90, it will break it. Yes? Usually it should be what? In children it is? In children it's higher, for it will become 1. Yes. So we keep it 125, 126. Yes? Here usual angle is 130. Usual angle is 130. Clear? This is clear, yes? So, from up, measured, yes? This is major tubercle, minor tubercle, in between you will be having sulcus, yes? And this is anatomic neck, and you can see from down. Once you are seeing from down, again you can see what this is capitulum, this is trochlea, and posterior is fossa olecrani, and posterior side of epicondyle, medial epicondyle, you will be having what? Yes, here there will be what? Sulcus for what nerve? Ulnar nerve. And anterior side you can find what? Processus supracondylaris. So once you press it over here, you can find epicondyle, and on top of that you can find the process. Understood? Behind this we put hand, it is here.